they wanted no silos to break down what the NIH would do, what the FDA would do, what CMS would do. They insisted that the physician leaders bust through the clutter because their agencies had the power. I think you all appreciate the passion in the president's voice. We've been hearing that since the inauguration. In fact, even before the inauguration, the president was upset about what he spoke to today. And so together with Secretary Kennedy, who's made it his life's work to address some of these challenges with autism, they challenged us. In fact, they were harsher than that. They wanted no silos to break down what the NIH would do, what the FDA would do, what CMS would do. They insisted that the physician leaders bust through the clutter because their agencies had the power. If we didn't do what every other prior administration had done, which is to let people function within their siloed environments. Because of that, in historic fashion and a very accelerated manner, we have a response today to the autism crisis. It is the first of several chapters, but this is breaking news. You've heard some of it. The response to the autism crisis is going to continue to come to you under Secretary Kennedy's leadership, and the president wouldn't have it any other way, as you've heard. The FDA, based on NIH research, is approving prescription leucovorin for treatment of autistic children. Now, if you're following the script, there should be two questions that you have, two questions that should come to your mind. The first is, how will patients and parents get access to the treatment? I'll tell you how. Over half of American children are covered by Medicaid and CHIP, government health insurance, over half. And therefore, because they're covered in Medicaid and CHIP, upon this label change by Marty, state Medicaid programs in partnership with CMS will cover prescription leucovorin around the country. It's yours, but you have to go to a doctor to get a prescription because they know your child, they know you, and they know the medication. States will also have tools to monitor its use and ensure appropriate utilization. That's important for a bunch of reasons, because we want the right kids getting the right prescription medications. We believe private insurance companies will rapidly follow our lead if they have not already done so. And again, to make sure that this is safe and effective treatment, you need a physician to prescribe the medication because it's on prescription. Second big question, how are we going to collect clinical data to answer the big questions that the president's asking and the secretary insists that we offer? CMS is also issuing guidance to convene states and existing research networks to support NIH and FDA in their research efforts of prescription leucovorin, while also maintaining the privacy of all patients, all health information of our beneficiaries. Collecting real-world data, which is what many of you have been asking us to do in the community, is fast, it is life-saving, and we'll get answers based on what happens over the next few months with this approach. The aggressive approach, and it is aggressive, demanded by the president and by the secretary, have already identified risk factors and opened the door for the first FDA-recognized treatment pathway for autism. It is the first of its kind, and it wouldn't have happened without the leadership of the president and the secretary. The five-fold increased prevalence of autism over the past 25 years demands a rapid response. The average clinician, researcher, we spoke to many, thought it would take 5 years to get this data. Parents are unwilling to wait 5 years. The president is unwilling to wait 5 years for these results. So the president and the secretary are acting today with this tri-agency move. The administration's bold actions investing in groundbreaking research follow the science, they restore trust, which has been lacking, and they will change the trajectory for millions of American families. Mr. President, God bless you for being brave. So let me introduce Dr. Fink, who's acting administrator, and after Dr. Fink, we've got some wonderful women, Jackie and Amanda. I know it's going to be tough, but if you can make some comments about this historic day. God bless you.
Taken out, we're having them taken out of the vaccines. Hepatitis B, again, that's sexually transmitted, and we think you should wait. I think you should wait till 12. You know, I'm making these statements from me. I'm not making them from these doctors, because when they talk about, you know, different results, different studies, I talk about a lot of common sense, and they have that too. They have that too, a lot. But I recommend the hepatitis B. Take it at 12. Sexually transmitted. You don't have to give it to the baby when the baby's 2 years old, and there are a lot of theories on that, but not when they're 12. It's not, doesn't seem to be a problem at all. The MMR and the chickenpox. Chickenpox has already been broken out. It's a singular shot, but the MMR is is not. And I've heard for years that there's a problem with it. But they say that there's no problem if you do each shot separately, not put together. So an MMR, go out and do it separately. Don't take Tylenol. Don't give Tylenol to the baby after the baby's born. Every time the baby gets a shot, the baby gets a shot. They say, here, take a cup of Tylenol. I've heard that for years. Take Tylenol. Don't take Tylenol. Don't have your baby take Tylenol. Now, Tylenol is fine for people that aren't pregnant, that aren't in a situation that we're talking about. One very specific situation. If you're pregnant, don't take Tylenol. When you have your baby, don't give your baby Tylenol at all, unless it's absolutely necessary. Don't do it. Break up your visits to the doctors. Break them up. Do it in 5 if you can.